Hello friends, welcome back to Complete Medical Coding. Today let's discuss few more anatomical questions, CPC anatomical questions from this year 2025. Okay, few anatomical questions that have been asked. Some important questions among that. Okay, so that's what I'm going to do it today. Hope you people are liking my videos. Hope it is useful. So please share it among your friends. Anyway, let's move to the questions. Moving to the first question. Which of the following is not a part of the axial skeleton? Option A sternum, option B vertebral column, option C scapula, and option D skull. Which is which of the following is not a part of the axial skeleton? Okay, the answer is option C, scapula. That is not a part of the axial skeleton. Remaining sternum, vertebral column, and skull are the parts of axial skeleton. Okay. Those who are from science background, they'll be knowing it all anatomical questions. But those who are not from science background, you will find it little difficult to learn the anatomical terms and medical terminologies. So you can use my videos. It will be very useful for you. Mostly I am trying to cover all the anatomical parts. Okay. Now, second question. The patient is diagnosed with trichomycosis. The patient has. What does the patient is having if the patient is diagnosed with trichomycosis? What does it mean, trichomycosis? Option A, skin tumor. Option B, fungal infection of hair. Option C, diffused skin. And option D, inflammation of nail and nail bed. So trichomycosis, it represents a fungal infection of hair. So answer is option B. Trichomycosis is fungal infection of hair. Okay. Third question. Which of the following best describes the process whereby the stomach muscles contract to propel food through the digestive tract? So what is the medical term of that procedure? Okay, where the muscles of the stomach contract to propel food through the digestive tract. Option A, absorption. Option B, emulsion. Option C, peristalsis. And option D, regurgitation. So here the process where the muscles of the stomach contract to propel food through the digestive tract, it is called as, answer is option C, peristalsis. Okay. Fourth question. Which of the following describes the cluster of blood capillaries found in each nephron in the kidney? The cluster of blood capillaries, the group of blood capillaries, what is it called? Which is found in the kidney, nephrons in kidney. Option A, afferent arteriole. Option B, glomerulus. Option C, loop of Henle. And option D, renal pelvis. So the cluster or the group of blood capillaries which is found in nephron in the kidney, it is called as, answer is option B, glomerulus. Okay. Cluster of blood capillaries in the nephron is called as glomerulus. Now fifth question. What is thoracentesis? When I had taken anatomy chapter before, I had mentioned this about thoracentesis. Okay, what is thoracentesis? Option A, pain in the thoracic region. Option B, surgical incision into the thoracic region. Option C, puncture aspiration of fluid from the thoracic region. And option D, excision of the lung. So what is thoracentesis? Answer is option C, puncture aspiration of fluid from the thoracic region. So thoracentesis, as you know, it is something which is related to the thoracic region. But what exactly it is? Puncture aspiration of fluid from the thoracic region. Okay. Now, moving to the sixth question. How many lobes are present in a pair of lung? How many lobes are present in a pair of lung? How many lobes are present in a pair of lung? Option A 4, option B 5, option C 6 and option D 7. How many lobes are present in a pair of lung? Answer is option B 5, 5 lobes. Okay, there will be 3 lobes on the right lung and left lung consists of only 2 lobes because heart is present on the left. You can learn like this. Since heart is present on our left side, so left side of the lung is having only 2 lobes, whereas right side of the lung is having 3 lobes. Hence total 5 lobes. Okay, so 5 lobes are present in a pair of lungs. 7th question. Which of the following is an endocrine disorder? Endocrine disorder. Option A, Addison's disease. Option B, Cushing's disease. Option C, Graves' disease. And option D, all of the above. Endocrine disorder. Answer is option D, all of the above. All these are endocrine disorders. Okay, Addison's disease, Cushing's disease, Graves' disease, all are endocrine disorders. Moving to 8th question. Where is the location of the lunula? Lunula. What do you mean by lunula? Option A, base of the nail. Option B, tip of the nail. Option C, edge of the nail. And option D, beneath the nail. So, lunula, it is something which is related to the nail. Okay. So, what does lunula means, or where is this, what do you mean by that lunula? Lunula is something which is whitish area of the bed of a fingernail or toenail. In the nail, the whitish color, no, that is called as lunula. So, the answer here is option A, base of the nail. Okay. So, lunula is located on the base of the nail. Alright. Moving to the 9th question. Clear outer layer at the front of the eye is known as the outer layer at the front of the eye. Which part represents the clear outer layer of the front of the eye? Option A, cornea. Option B, conjunctiva. Option C, sclera. And option D, retina. The outer layer of the eye, clear outer layer of the eye is called as cornea. Answer is option A, cornea. Okay. 10th question. Which is the main muscle that help in the movement of head? Movement of head. The main muscle that helps in the movement of head is called as option A, hamstrings. Option B, facial muscles. Option C, platysma. And option D, sternocleidomastoid. The main muscle which helps in the movement of head. Okay, the answer is option D, sternocleidomastoid. That is the answer, main muscle. Okay, that helps in the movement of head. Alright, so that's it. These are few important anatomical questions which has been taken from CPC anatomical questions from this year 2025. So hope you like this video. If you find this video useful, please like and share it among your friends. Okay, so thank you so much, friends. Those who are new to the channel, please support me. Please subscribe to the channel. And thank you so much. Stay tuned for more questions. Stay tuned for more videos. Thank you so much and bye. Take care. See you soon in the next episode.